Hey everyone, it's Tim from Linessa Farms, specialty in heirloom livestock. Thanks for joining us again today. Have you ever had to give medication to your animals, your sheep, your goats, even a cow or a pig? There are lots and lots of things to know about medication administration. And although we've covered this a lot in the past, we wanted to take some time today to get back into the basics of medication administration and talk to you about the different routes that you can give medications and specifically how to go about doing it. Stay tuned to find out more. All right, so as we get rolling with this video, if you look in the description section below, I'm going to have some time marks down there that are going to get you to the specific area that you may want to know about. So for example, if you just want to know about, or you're here to refer to subcutaneous injections, you're not going to want to have to watch everything else. So check out the description below and I'll kind of help you out as far as to leading you where it is that you need to go. Before we start talking about and medication administration in more specific terms, we need to talk about the rights of medication administration. So, you know, in human healthcare, we talk about, sometimes you see there's 6 rights, sometimes you see that there's 9 rights, but as far as I can tell, when you're operating on your farm, there's 4 basic rights that I want you to make sure that you're following when you're administering medication to your animals. And I have those written out right here. So the 4 basic rights that you need to make sure that you're doing correctly are as follows. So number 1, we want to talk about the right animal. What do I mean by that? I mean, if your medication is listed only for goats and you're giving it to a sheep, you need to make sure that that is appropriate. Now, there are a lot of medications that are used off-label, and off-label just means that it's not approved for treatment of the animal that you're treating it for. But unfortunately, in veterinary medicine, we use this a lot. But the main thing that I want you to know is make sure that you're doing the right animal. This could also be within a breed. So for example, some medications may cause abortion if you or miscarriage if you give it to a pregnant animal. Some medications you can only give to adult and you can't give to a little one. So things that you need to keep in mind, make sure that the medication that you're giving is appropriate for that animal. Age, sex, and breed. The next thing that I want you to cover or to think about is the right medication. Is this the appropriate medication for what it is that's going on with your animal, or are you just guessing and throwing medications at them? Do you know that the medication that you're administering is appropriate for what's going on? You may think that the animal has a worm load, but if you haven't checked them out appropriately, they may be suffering from some kind of an infection, or vice versa. So again, we want to make sure that you're giving the right medication for the job. Number 3, right dose. This is very important. More is not necessarily better. So I don't want you to fall into that trap. Underdosing and overdosing can both be extremely dangerous. Now, when it comes to medication, we do have a treatment window that you can generally fall into where you can give a little bit more and it's not going to be dangerous. You can give a little bit less and it's not going to be dangerous. But if you start to skew too far outside of those boundaries, bad things can happen. So let's assume that your individual animal may have, again, we're going to use worming as an example. Let's say they have a really heavy worm load, and on your Dectomax bottle, it says that they want you to give 1 milliliter per 110 pounds of body weight, and your animal weighs 120 pounds, and you think to yourself, I'm just going to give 2 milliliters and we'll be fine. You know, that may not be appropriate for the animal. With the same token, maybe you don't have enough of something to go around, so you're not giving as much as you should be giving. And in this case, this can lead to, exacerbated problems like you're amplifying an infection, you're creating worm resistance, you're perhaps not eliminating all the worms in the body and more coming back, so on and so forth. So again, right dose is very, very important, and probably one of the most how do I want to put this? One of the rules that is least followed is the right route. And that's a lot about what we're talking about in this video today. So when I talk about route, I'm talking about the route that the medication should be administered. We're going to talk today about ophthalmic, giving medications in the eye. We're going to talk about oral boluses, oral drenches, and then we're going to talk about subcutaneous injections and intramuscular injections and why this matters. Again, all the directions that are on the medications that you purchase have very specific directions on there that should be followed that tell you, okay, this is going to be administered subcutaneously, this is going to be administered intramuscularly, and that does matter. You can cause very, very, very dangerous side effects. You can cause harm to the animal, or you could just not get the effects that you're wanting at all if you give this to the animal in the wrong route. So not to take up too much of your time in the deep weeds of medication administration rights, but this is very, very important and something that I want you to consider at all times. There are additional rights that you can follow that may be more specific to you and the animals that you raise, or the livestock medications that you're giving, but these 4 basic rights are the ones that you definitely want to follow. Right animal, right medication, right dose, and right route. All right, so here's some of the different routes that we're going to be talking about today in the order that we're going to be talking about them. So first of all, we're going to start off with the oral medications. Now, oral medications can generally be given in one of 2 ways. You can be given in an oral bolus, and this would be more like a large pill that you would give to the animal. And this is usually given with what's called a balling gun or a bolus gun. The next one is an oral drench. So oral drench is like giving a large amount of liquid through the mouth, and this is done with a drenching gun, and we're going to show you that as well. Then we're going to get into the ophthalmic. This is given through the eye. So this would be medication that's administered into the eye. Generally speaking, there's only a very few set of examples that I can think of that you would use this, but the main one is going to be pink eye. And if you're in animals long enough, you are going to see pink eye. So this is very important to learn as well. And then we're getting down into our 2 injections. And actually there's 3 injections, but the last one that's not listed here, we're going to cover in its very own video. So the 2 injections that you're going to use the most often are subcutaneous. That's often referred to as sub-Q, which means under the skin. That's what subcutaneous means. Sub meaning under, cutaneous meaning skin. And then intramuscular. So these are often called IM injections, and this is actually given deep into the muscle. So these 5 are the ones that we're going to be covering today. So we're going to talk about them in here on the board, and then we're actually going to go out and give them to the animals, and you're going to see how we do that. So let's get ready to go through these one at a time. We'll go through them. We'll show you the tools that you need in order to make this happen, and we'll take it from there. All right, so the first one that we're going to talk about is the oral bolus. Bolus can be used in many different ways. When we say bolus, we're just talking about a single time dose, like a very specific dose that's going to be given all at one time. So you may actually see this term used in things like intravenous administration, but for all intents and purposes, what we're talking about here today, when you see the term bolus or a bolusing gun, we're just talking about an oral bolus medication. So the most common medications that you're going to see that utilize this are medications for fever like aspirin, and you're also going to see this one a lot, and this is copper boluses for goats. Now, if you've ever tried to give something to a sheep or a goat through the mouth that's not liquid, that's just like a pill or something, you know how difficult this can be. And this is where our bolus gun comes into play. So our bolus gun, these can be made out of metal or plastic. You can get these at your farm supply store. And there's actually a plunger inside of here. So I would drop my bolus in here. I would get this as far back in the mouth to the back of the throat as I can and pop it in there, and it should fall out. When it falls out, I can withdraw this from the mouth, and hopefully the pill, the bolus itself, gets where it needs to go. I will let you know that these are extremely difficult to use. The outcomes of these are generally not that great, so you're going to have to follow up with your animal. Once you administer this, don't assume that they swallowed it and just walk away. You're going to have to make sure that they don't spit this out. What I have found, a few tricks that I am going to tell you about. So we talked about back of the throat, and we talked about what this is. Consider using petroleum jelly. So the reason I want you to consider using petroleum jelly, in this case, I have a copper bolus here, and if I drop this into my bolus gun, you'll notice as soon as I turn it upside down, what happens with a little bit of movement is it falls out. Now the inside of this is actually a little sticky because I've used petroleum jelly before. But what I'm going to advise you do is dip this in some petroleum jelly. It won't hurt your animal at all. Get it down in here with the petroleum jelly on it, and then go ahead and try to put it in the mouth. That way the bolus tends to stick into the gun until you push on it and it comes out. The other thing that I would advise is immediately follow this with an oral drench of water to help make the animal swallow it. So again, this is just going to go in the side of the mouth as far back into the throat as we can without hurting or damaging the animal. We're going to hold the head up. We're going to stick it down the back of the throat, pop on that, get the bolus to go in, follow with an oral drench of water, and verify that they swallow. And once they've swallowed, you should be home free. So with that being said, let's head out to the pasture and take a look at giving an oral bolus with a bolusing gun to an animal. All right, so here we are outside in the yard. We got our little baby goat here, and we're going to be giving this baby goat an oral bolus of copper. And this is going to help for lots of different things that we're not going to get into in this video. So I have my appropriate copper bolus here, and I'm going to dip this in a little bit of Vaseline. I'm going to pull my plunger back on my bolusing gun, drop this in, and set this down. The next thing I'm going to do is draw up about 10 milliliters of just tap water, nice room temperature tap water, and this is going to be to chase this bolus with. Again, you want to get this as far back as you can. It's going to make it a lot easier. So you're going to notice I'm going to tilt the baby's head up so I create a nice straight line with their throat. It'll aid in helping them to swallow this. So I'm going to get it as far back in there as I can. Take my plunger, drop it down. Then I'm going to follow this with a drench. Help them swallow it. If you think maybe they didn't get it all down, you can drench them again. So I'm going to drench him one more time. I can hear him crunching a little. There we go. I'm sure that he swallowed it that time. And so it's just that easy. Two things that are going to save your butt on this one. The liquid, very, very important, and the petroleum jelly, because it's going to help it to stick in there on that plunger. And without that petroleum jelly, it's just going to fall out as soon as you tip it up. All right, so the next one we're going to talk about is oral drench. So when I refer to oral drench, we're just talking about giving quantity of fluid through the mouth to the animal all at one time. There's various sizes of drenching guns that you can use. This is a 30 milliliter drenching gun. I believe this one is a 200 milliliter drenching gun. This would be for large boluses like our copper sulfate warmer. This is going to be for smaller things like chemical warmers and vitamin supplements, things like that you may run into. You'll notice that all the drenching guns are very similar in the fact that they have this steel, what we call a lead on it, and this lead is designed to do two things. One, it's very rigid, and so the animal can bite on it all they want and it's not going to hurt them at all, and it's not going to damage this at all. The other thing is, you notice it's angled and it's nice and long, and the reason for that is we want to go in through the corner of the mouth, straighten it out, and we want to get all the way back, as far back in the mouth as we can get. And instead of squirting that liquid directly down their throat, because of the angle, it's actually going to hit the throat wall first and run down. And this benefits the animal so they don't choke. You don't want to just stick the tip of this in their mouth and give them a squirt. They're just going to spit it all out all over the ground. Very simple to use. With a little bit of practice, you'll be very good at using this in no time. Just make sure you clean it out really good after you're done using it, because these are known to get pretty gunky and pretty nasty in a hurry. One more medication I'd like to add to that I didn't think of would be some of your antidiuretics, things like Spectam, Spectamycin, Pepto-Bismol, things like that. All of those, this would be the item of choice that you would want to use. So with that being said, let's head out to the pasture and take a look at how we administer an oral drench. All right, so we just covered this in our video where we were doing our oral bolus, but I'm going to cover it again just for your sake. We're going to draw up about 5 milliliters of water in our drench gun here. And again, you want this long lead to bypass the tongue and get closer to the back of the throat. It'll help to hold the animal's head up. Just go in the corner. Okay. We lost a little out of the corner of his mouth. You're generally going to lose just a little bit. It's very, very difficult, especially with the little ones, to get him to take all of it. But I feel like he got most of that, did a pretty good job. So that is our oral drench. All right, so the next one we're going to talk about is our ophthalmic medications, and these are the medications that go in the eyes. Pretty rare that you're going to use these, but you're going to see this with pink eye. And if you've been around animals long enough, you know that every once in a while they get pink eye. This is usually caused by various strains of viruses and bacteria, to include chlamydia. So side note, always make sure that you wear proper hand protection. A lot of times you'll see this with dusty conditions, dusty dry conditions, dusty hay, things like that. They're going to get redness or eventual pink to whiteness that'll cloud over their eye, and you're going to have to give some kind of medication. Now, two basic types of medication that we see given, either a paste or a liquid. The paste is going to come in little bottles like this little itty bitty bottle of terramycin here. I think at Tractor Supply this is like $14, and it works so for the purpose of pink eye. What we like to use here on the farm is I like to use penicillin suspended in water, which is a liquid. I will actually just fill up my syringe with 1 milliliter of penicillin, and I will administer that directly into the eye. Not with a needle on it, just with an empty syringe. If I get close enough to the eye and I dribble it out, the eye will just kind of suck it up and coat the entire eye. And so we'll talk a little bit about that when we get out to the yard here in a minute. So this, I'm not an artist, you guys know this, but this is the eyeball itself, and this represents the nose. If you're going to be administering any kind of paste, you want to clean the area well with a clean rag, clean damp rag before you start, and then you're going to want to pull down the eyelid, and you're going to want to administer a thin ribbon of that paste on the bottom inside of that eyelid, and then just let the eyelid close up. You're going to want to keep the metal tip of this out of the eye. You don't want to scrape this across the eye, but you want to get it in there. And again, very, very thin ribbon of this, a little bit goes a very long way. In the case of administering liquid penicillin into the eye, the animal is naturally going to want to close their eye tight as you get close to it and as you start handling it. So in this case, what I do is I come at the eye from a top angle to have gravity help me out. I get the tip of this syringe just inside the eyelid and give them a squeeze, and you'll see the entire eye will fill up with the penicillin. So that's about it as far as ophthalmic medication administration. Let's head out to the yard and take a look. All right, so in this one I'm going to show you how to give the ophthalmic paste, and this would be our terramycin that most of you would use. The first thing I want to do is, if there's any gunk underneath the eye, I've got a nice clean damp rag. I'm just ever so gently going to clean that eye out. And you see when I go near the animal's eye, he or she's going to want to squint it closed in most cases. In this case, I'm just going to pull down on the eyelid just a little bit, and I'm going to apply the ribbon from the inside of the eye to the outside. Now, keep in mind, when you take the lid off of this terramycin, it is going to come out like crazy, so you want to move as fast as possible. So I'm just going to pull it down and apply a thin ribbon along the bottom of the eyelid, just like that. There we go. Notice I'm not getting the tip into the eye. Then I'm going to close the eye and open it, and close the eye and open it, and you can see I've got a nice clean coating in there. I didn't get the tip in the eyeball itself. I got the medication to where it's in the eye and resting on the eye, and there was no real discomfort to the animal. If you need to wipe any excess off, you can start at the inner canthus, we say inner canthus, the area closest to the nose, and wipe away. You don't ever want to wipe this way, you always want to wipe away. In her case, there's not a lot of extra, so I'm not going to go through the hassle of doing that. Alrighty, So that's it for applying ophthalmic paste. All right, so now we're going to talk about our ophthalmic liquid administration. So in this case, liquid penicillin goes a very, very long way. I like to use this. This is kind of my go-to for my animals that get pink eye. I apply it twice a day for about 2 days after the pink eye actually clears up, and it tends to work pretty quick. So this is just aqueous penicillin that you can buy at Tractor Supply. I just draw this up with a needle, and then I take the needle off, and I've got a nice clean tip here. And when I go towards the animal, again, if I have any issues with the animal to where they have any kind of drainage in their eye, I'm going to clean this off first. Then I will just kind of hold the eye closed with my fingers, get this right in the corner of the eye, and squeeze. And you can see how that completely coats the eye, the eyeball, and the inner eye. Then I can take a rag if I need to and gently wipe and clean her off, and you're good as can be. And you're going to do that for pink eye. I like to do this twice a day until the pink eye is completely gone, and then continue for 2 days. One thing I will talk to you about with administering this for pink eye is if they've got an infection in one eye, I want you to treat both eyes. Don't just treat the eye that's infected. Go ahead and treat both eyes. Again, twice a day till it goes away, and then continue treatment for 2 days more. All right, so we've moved on now to the last two that I want to cover today, and those are subcutaneous and IM injections. But before we did that, I want to just talk with you briefly about 3 different types of general injections that you're going to encounter doing veterinary work or doing small farm work on your farm, and those are intravenous, intramuscular, and subcutaneous injections. Now, we're not covering intravenous today because that's going to get its own video. We're going to talk to you about intravenous drug administration and, more importantly, blood draw from an intravenous stick. It takes a lot. It's going to be its very own video. So I just wanted to talk to you about the speed of absorption, though, and why we do give medications in specific ways. So anytime we're administering a medication IV, intravenous, this is a medication that instantly gets into the bloodstream. You are literally putting the medication into the bloodstream, and once you push it, there's no turning back. Once you give that medication, you better make sure that your dose is correct, because once you give it, it's in the system and there's nothing you can do to pull it back out. Not to say that the IM and sub-Q, there's anything you can do to remove it from the body, but the IV is by far the fastest route of administration. Certain medications are made specifically to be administered in certain ways. You would never want to give a medication made for IM or sub-Q into the IV. Most medications will tell you do not give IV. There's a few exceptions to that, such as vitamin B. Intramuscular is probably the second fastest route of administration. This gets it into the system quickly. It gets it into the large muscle group, and the body can start metabolizing it slowly, almost immediately once it's placed into the system. Subcutaneous, these are our injections that we want to make them last a little bit longer. These are administered between the skin and the muscle layer, and the body slowly absorbs it over time. This is probably one of the most preferred methods for administration, and this is what we administer most of our medications as, is subcutaneous. Unless there's a reason why I need to give it really fast, I avoid IM shots and IV shots for a couple different reasons. The main one is a route of administration also has very specific amounts of infection related to them. You are far more likely to get an infection with intravenous than you are with IM. You're far more likely to get an infection with IM than you are with sub-Q. It's just more trauma to the animal, more damage to the tissue, and you're opening them up for more infection. So again, sub-Q is probably the most common one, and then IM. The other advantage of giving sub-Q as opposed to IM is I can give a larger dose subcutaneously without damaging the animal than I can IM, and this also doesn't damage cuts of meat. When I'm giving intramuscular injections into the hip or into the neck, as we'll talk about here in a moment, there can be some scarring and some damage that's actually done to the animal through the I'm having a hard time talking today. Through the injection process. So with that being said, let's move on to our subcutaneous injection. All right, so subcutaneous injections. When we say sub-Q, we mean it's given between the skin and the tissue. So this is our needle coming in. This is our layer of skin. This is this interstitial space, the space between the skin and the muscle or the actual meat. And so this is where we want to give it. Our needle is going to go in at a very shallow angle to the flesh. We're going to pull up on the skin and we're going to just puncture the skin. And before we actually get into the muscle, we're going to inject the medication there. This is usually less painful for the animal, and again, you can get a little bit of a larger dose in there. For all injections that we're going to talk about, I'm going to make this really simple for you. There's lots of different gauges out there of needles. The smaller you get in needle size, the bigger it gets. So for instance, an 18 gauge needle, this is going to be larger than a 20 gauge and smaller than a 16 gauge. If you get 18 gauge 1-inch needles, you are going to be just fine. That will cover pretty much everything that you need to do. If you get less than 1 inch, you're going to be running into issues where it's not quite long enough. If you get more than 1 inch, you're going to have this really long needle that's going to be awkward to handle. So again, 1-inch needles. The other thing that you can use that you'll get along just fine with will be a 5 milliliter syringe. And the 5 ml syringe will pretty much cover everything that you need it to cover as well. So just go out and buy you some 18 gauge 1-inch needles and some 5 ml syringes, and it should cover just darn near about everything that you can think of that you need to use under the sun. So again, our injection is going to be it's going to be given between the skin and the tissue, and we're going to want to give it in this area right here, and you're going to see that a little bit more, and you're going to understand why a little bit more when we get out into the yard. I know you're really liking our sheep drawings. If anyone would like a personalized sheep drawing, just send me an email. I'd be more than happy to send you one. So this is the area that you're going to want to give it. Then the armpit, I guess you would call it the armpit area. In fancy terms on your medication bottle, a lot of times you're going to see it listed as the axillary area, because God forbid we actually use the term armpit. Even on humans, when we talk about it, we talk about the axillary, which is the armpit area. So you may see on the bottle, may say administer near or at the axillary area, and that's all that they mean. I know with your dogs and cats at home, they teach you to pull up the skin on the back of the neck and give it that way. That's not the way that we give subcutaneous injections to sheep and goats. So remember, axillary area is the best area, and we'll show you why when we get out to the yard. With that being said, let's head out to the yard and give an injection. All right, so we're getting ready to give our subcutaneous injection. And if you come over here and you look, you'll see the reason that I told you to give the injection in this axillary. If you look here, what do you got? You got wool, wool, wool. And then look here. When I pull this back, see how you have this nice area of skin? And this area of skin is in goats and in sheep. So this is where I'm going to give my subcutaneous injection. Again, I've got my 5 milliliter syringe. I've got my 18 gauge 1-inch needle on here. And I'm just going to pull the skin up with my fingers so I get a little bit of a tent. Then I'm going to go into the skin, inject, remove, and I'm good to go. All right, last but not least, let's talk about intramuscular injections. Again, I still want you following the 18 gauge 1-inch 5 ml rule, and obviously with IM injections, intramuscular kind of makes sense as far as where this needle is going. Our needle is going into the muscle. We're going to be at a more aggressive angle with our needle, because our needle is going to go down through the skin all the way down into the muscle tissue. The beauty of a 1-inch needle is you can almost go straight at a 90-degree angle and bury that needle, and you don't have to worry about hitting anything in the process. Generally, our medications that we're going to see the intramuscular given with can be some vaccines, antibiotics, and vitamins. Vaccines, these two are questionable. The vaccines and the antibiotics, some are given IM, some are not. Some will be given sub-Q as well. It just depends on what the manufacturer's directions are. And then our vitamins are generally tend to be given IM as well. I guess an honorable mention would be some injectable wormers, such as injectable ivermectin and injectable Dectomax. So this is our sheep here. Personally, I don't think I did as good a job of drawing it as I did the first one. His legs are a little short, but that's okay. So the two places that you're going to want to do your injections are going to be in the neck at the neck-shoulder junction, and then in the rump. The neck is probably one of your easier administration routes, and the rump. This is, of course, your leg of lamb or your leg of goat is your premium cut of meat for that animal. So if you're going to give injections there, just be aware of the fact that you may cause some damage to the site of injection. That's why we tend to want to go more for the neck. When we get out into the yard, we'll show you a little bit more about that and show you the landmarks that you're going to want to follow to show you exactly where to give the shot. So with that being said, let's head out to the yard one more time. Alrighty, so this is Juno. And Juno is going to be our demonstration for our intramuscular injection. So two areas that I want to talk to you about for your intramuscular injection is going to be back here on the hip. If you can feel the hip bone, the pin right here, and you're going to feel another one right here. So a little bump here and a little bump here. You're going to go in right there. So here's the two landmarks, and this is where I want you to go. So directly in between and a little bit forward. And this is a nice big muscle group that's right here. The other place you could go would be halfway between this bump and the rectum, right here on the hip as well. That would be another place that you could give it. I prefer to give it over here. So I'm going to find my landmark. And I can go in at a 90-degree angle. Now you notice when we did the subcutaneous injection, I was going in really shallow. And that's because I was just going under the skin. In this case, I can go straight down at a 90-degree angle and get into the muscle. I'm not going to give the injection in the muscle today. I'm actually going to go up towards the neck and give the injection here. So I've got a fold line here that I can feel with my hands where the neck itself meets the shoulder blade, the scapula, and I can feel this shoulder blade bone right here. I want to go, if I could divide this in half and in half. So imagine I've got the front, I've got the back, and I've got the middle. I want to draw an imaginary line between the middle and the back, which would put me right about here. And I want to go 3 finger widths up from the shoulder blade. So shoulder blade, 3 fingers, halfway between the middle and the back, which would put me right about here, and I'm going to aim slightly forward. All the arteries and the veins are farther up here in the front, so you don't have to worry about hitting them. And you don't have to go bury it all the way in. Obviously, if the animals are bigger, you're going to have lots and lots of meat. This is a lamb, and so I don't have lots and lots of meat. I just want to make sure I was into the muscle. On a big buck or on a big breeding ewe, sometimes I've got muscle like that, and I can't even get, I'm barely getting in there. So you want to make sure that don't count your wool thickness. That's something a lot of people screw up on. Make sure that you're actually into the tissue. Make sure that you bury this in as far as you need to get the injection in. So with that being said, that's our intramuscular injection. All right, well, I hope today's series was enjoyable for you and you learned a whole lot. The last thing I just want to say before I let you go today is make sure you contact your veterinarian. I'm giving you examples on how to do things for those of you that either don't have access to a veterinarian or you want to attempt to do it on your own, but I am not a suitable substitute for an actual veterinarian. Even we have to use veterinarians here on our farm from time to time when things get out of hand or I don't have exact answers for questions that I may have regarding what's going on. So try to establish a relationship with a veterinarian before you have problems. Don't wait until you have a problem to contact the vet. There's no harm in contacting your local veterinarian, just saying, hi, I'm so-and-so and I live in the area and I raise sheep and goats and I would like to have your number on hand in case we have any issues. Get their hours of operation. They may even give you an after hours telephone number to call, but it's time well spent to establish a relationship with your veterinarian as early as possible. With that being said, I'm Tim from Linessa Farms Specialty and Heirloom Livestock. Thanks for joining us again. We have lots and lots of videos that are super cool that are going to be coming out soon. We look forward to seeing you again next time.